Thank you very much. The organizer give me an opportunity to present in the new generation NRTI in China study. And only the 10 minutes, right? And okay, I pay attention, definitely. So, in China, the HIV and prevalence is still low. And because China is a big country and a huge population, but in HIV transmission, it's over 97% is a sex transmission. So we have to pay for the young generation about the HIV. All studies show HIV, HBV, HCV co-infection in China is going down. And because the HBV vaccine program and HCV and testing and screening and treatment program, and all studies show for HIV alone and HIV co-infection, the treatment outcome is very good in China. So, but right now we have to pay attention for the cardio CVD and the problem, and the Taiwan doctor gave a good presentation about using the integrase inhibitor. Right now, we call that time is an integrase inhibitor, but we also find if the patient is a treatment with an integrase inhibitor, especially for the second generation increase inhibitor, we find the higher risk of the ASCVD and other problems. And this study show, and even though in the young generation, the young group people, like our study is 18 to 29 years group, and also we find some in subclinical and problems. And today I will give a brief introduce of the new medication. It is the next generation, the NNRTI, and the name is Ainuovirine. So compare the classical, the NNRTI, efavirenz or nevirapine, I think, and the Ainuovirine is a very special molecular structure. And we also conduct the compare study about the drug resistance and the mutation. The compare Ainuovirine and efavirenz and nevirapine. The Ainuovirine is much better compare the efavirenz and the nevirapine. And the main the study is the 2 phase 3 multi-center randomized clinical trial study in China about Ainuovirine. The first one is a research. And this target population is a naive patient. And Ainuovirine plus 3TC and the TDF plus the efavirenz placebo. Another group is efavirenz 3TC and the TDF. The phase 1 is 48 weeks. And then the efavirenz group switched to the Ainuovirine, continuing to receive the study. So the second RCT clinical trial is Ainuovirine group versus the integrase inhibitor, EVG, cobicistat, FTC, and the TAF. So, and the baseline patient characteristic, and we can find both the group, both the study, and we can comparable and no significant in the study group and the observed the group. And biological efficacy in the first study, the Ainuovirine is a red bar, and the blue bar is the efavirenz, and we can find it's comparable. Is the HIV RNA less 50 copies is 85% worse than the 91%, and the 96 weeks in the Ainuovirine group is 84%. The compare group is 83%. And the second study is Ainuovirine compare the integrase inhibitor EVG cobicistat, and also we find that at the 48 weeks, the Ainuovirine group is 97%. The integrase group is 98%. At the 96 weeks, also maintain a very higher biological suppression, and the Ainuovirine group is 97, and the integrase inhibitor is 96%. And the immunology efficacy, we compare the CD4 and after treatment, and the two groups no significant in the Ainuovirine versus efavirenz. And another study is that the Ainuovirine compare the integrase inhibitor EVG cobicistat group. Also, both group and the increasing CD4 is better, but no significant in analysis. And the more important is a treatment safety and study. In the first study, compare the efavirenz, we find, and everybody know the efavirenz and the CNS toxicity, and compare the new generation, and Ainuovirine is much better compare the CNS. And the second study is the EVG cobicistat group compare the Ainuovirine, and we pay attention for the AE, we find the triglycerides and the cholesterol increase, and also the uric acid increasing in the efavirenz. And the Ainuovirine is much better compare the integrase group. So, and we also pay attention for the weight gain, and the Ainuovirine is much better compared the EVG group. So we also to testing the other the lipid, we can find if using the Ainuovirine and the LDL and is going down. And the change of the LDL-C and the integrase inhibitor and the EVG is increasing a little bit. So, and a summary of my report, and although the HIV in young generation prevalence still low, but in this group population is sex is very active, and we should pay attention, especially for the gay man population. The second, and right now, and we should be pay attention for the weight gain and some metabolic problem, if we using the integrase inhibitor. And Ainuovirine is a new generation NNRTI compared to classical efavirenz and navorapine, and for the efficacy is comparable, but it's a more safety, especially for CNS toxicity. Also, the main problem for the integrase inhibitor is metabolic issues and the weight gain. So I think this is should be paid more and more attention for both of the weight gain and the metabolic issues. And for the long term, we need the evidence about the risk. The last one is I should be, and thank you and all of the participants in this study. And it's over 12 the hospital is participated in this study. Thank you very much.